Aging can be rough, and when it comes to women who hit 40, you start seeing changes in your body from head to toe. But then when you go to the 50s, those changes really do kick in with the onslaught of menopause. How to do that?
I like that little kick. That was cute. Things like age spots, lines, even hair growing in places that you never thought you even had hair follicles. Well, our senior producer is finding all of those things out. She just turned 55. She looks great, but she wanted to go to the dermatologist, Dr. Jeanine Downie, for some solutions. Take a look.
We're going to wipe off with just a wet paper towel with water any residual sunblock, makeup. Patients will tell you they've taken off their makeup. They haven't. This is calibrating the laser. This is just making sure that we have it on the wavelength that we need it for her skin type. So it stings. Rebecca is very stoic. I wish all my patients were as good as her. It smells awful. That is a laser targeting the pigment in the hair follicle, because obviously you want the hair targeted, but you do not want the skin targeted. It's a light chemical peel of glycolic acid. It stings a little bit and feels a little zippy. This will help with the texture of Rebecca's skin, the tone. It helps with dark spots significantly, which is why we love it, especially from ingrown hairs. So this one's the Vivite glycolic chemical peel, and this one goes on for about 3 minutes. In addition, many patients in their 40s and 50s can't tolerate some of the harsher chemical peels, so that's why this one's so great. So this is truly a lunchtime peel that you can do on your lunch hour.
Things change so much when you're in your 50s. When it comes to maintenance, what would be your best advice?
My best advice for maintenance is to plan on spending more money on your skin and budgeting for that. Chemical peels 4 times a year. I recommend that people do Botox at least 3 times a year. I like Juvederm every 6 months. Literally use a teaspoon of collagen from your face every year from the time you're 30. Getting a skin check, making sure that your skin is healthy. So come right over here. We're going to have you splash off now. That was long enough for you to sit with the peel on. And now we put on the Vivite Replenishing Hydrating Cream, which is good for post-procedure. And then we put on some MD Forte aftercare sunscreen. And then you can go back to work.
Very cool.
Fighting your menopause as we go.
Well, Dr. Downie and Rebecca are here to talk a little bit about maintaining and fixing your skin after you hit the big 5.